This story happened in Chicago, United States, in 1998. Hospitals are built on order. Every floor is numbered, every room is cataloged, and every patient movement is recorded. Even small mistakes leave a paper trail. Nothing is supposed to exist without documentation. That is why staff members at a downtown Chicago hospital were unsettled when patients began mentioning a floor that was not listed anywhere in the building. The first reports came from intake paperwork. Multiple patients, admitted weeks apart and with no connection to each other, listed the same floor number when asked where they had received initial treatment. The floor they wrote down did not exist on any directory or map. At first, doctors assumed confusion caused by anesthesia, medication, or stress. The entries were corrected and forgotten until the pattern continued. Over the next several months, nurses noticed call lights activating on panels assigned to inactive zones. The lights appeared briefly, then shut off before anyone could respond. No rooms were officially assigned to those circuits. Then elevator panels began to behave strangely. One button would glow faintly for less than a second before going dark again. Maintenance replaced the bulbs, updated the software, and logged the issue as a technical glitch. The problem did not stop. By mid-year, medical charts began appearing with treatment notes that could not be accounted for. Vital signs were logged. Medications were documented. Each entry was signed by licensed staff members who denied being present. Hospital administration launched a quiet internal review. Archived blueprints revealed something unexpected. Early versions of the building plans showed an additional floor originally designated as a recovery ward. During construction, the floor was reassigned, merged into other departments, and officially removed from operation before the hospital opened. On paper, it had never functioned, but facility logs told a different story. Electrical consumption, water usage, and climate control data showed consistent activity originating from the abandoned floor range. The data spanned several years. Cleaning schedules also reflected repeated servicing of an area that allegedly did not exist. Security footage deepened the concern. Late-night recordings showed elevators stopping for extended periods between two active floors. The doors never opened on camera, but the system recorded each stop clearly. No alarms were triggered. One night shift nurse finally spoke to her supervisor. She claimed she had been assigned to that floor for a single overnight shift. She described unusually long hallways, muted lighting, and patients who rarely spoke. She remembered thinking the floor felt unfinished, yet fully operational. When she returned the next week, her assignment no longer appeared in the system. Her supervisor denied approving it. Payroll records still showed her working that night. Administration closed the investigation within weeks. No explanation was offered. Instead, changes were made quietly. Elevator panels were updated. One floor number was removed entirely, skipping from one number to the next. Internal directories were reprinted. Staff were instructed to follow the new numbering without discussion. After the renumbering, the reports stopped. Call lights no longer activated. Charts stopped appearing. Elevators no longer paused. Internal emails later revealed the reason was not resolution. It was containment. Records referencing the floor were archived. Discussions were discouraged. New employees were never told it existed. Today, the hospital still operates normally, but visitors sometimes notice something odd in the elevator, a missing number. And if they ask about it, the staff give the same answer. The building was always that way, according to the records, and no one is willing to say otherwise.